Destiny?
Yes.
Hi, I'm Lisa. I'll be your tech today. Can you confirm your last name and date of birth?
Marino 8699.
Okay. And I see you're here today for some pictures of your femur.
Mm-hmm.
Yes. Is it your right one?
Yes.
Okay. What we're going to do before we get started with that, I'm going to have you change. So what I'll need is your pants off. Probably shoes and socks can stay on. If you'd rather take your shoes off, you can leave just your socks on. This gown can go on open to the back, and I'll let you change, and then I'll come back and get you in just a minute.
Okay.
Okay. All right, so while she's changing, we'll set this up. We are gonna set 80 at 12.5, and since we're in the bucky, ideally we want large focal spot. So I've got it on 300 at 1/24 of a second, gives me 12.5. 80 kVp on that. On the femur, there's 4 views to a femur. There are 2 APs and 2 lateral. Because femur is a long bone, we have to get both joints with that. So what we end up doing is a proximal AP, a distal AP, a proximal lateral, and a distal lateral. Okay. Like I said, we're in the bucky because the part is greater than 10 centimeters. And we're above 60 kVp, so we're going to be in the table bucky. And usually the biggest thing with this that you want to try and do is get the femur that's affected in the center of the table if you can, so that you're not having to move the patient all over the place. We'll shield on the distal views, but probably not shield on the proximal views because she's a female. All right, y'all set? Mm-hmm. Come on in here. We'll let you have a seat on the edge of the table there. And we're just gonna go with history that we've asked her what she did, localize the area of injury, confirm that there was no previous surgery with that, kind of get all of those questions answered. We won't go through that on the video, we just know that we have done that. So we'll let you go ahead and lie back on your back. We know that there's no chance she's pregnant, because I should have asked that while she was out there. That's what I blanked on. All right, and what we'll do, you said it's your right femur, correct? Mm-hmm. I'm just gonna have you scoot to the left for me just a little bit. Good. Now, one of the things that we talk about with pelvis and with femur and with hip is making sure that they lay flat on the table. Most patients will lay flat, but how you can check that is you find both aces and you make sure that your hands are about the same height, like roll for me one way or the other. Like if she rolls, notice my hands change. They're not in the same parallel plane. Roll the other way. Good. Roll back. So when she's laying flat, both aces should be equidistant from the tabletop. Does that make sense? So they're both flat. Okay. All right. So we're going to put this shield on you. We said it was right leg. Now we have to include both joints. So what we're going to do, make sure we're in detail. We're at 40 inches to the bucky. Make sure we're aligned. All right. And we have a 14 by 17 in there. So what we're gonna do on this one is just get your, can you pause that? Okay, so on AP distal femur, what we're gonna do is normally the patient, you would likely be able to see their leg, but we know we need to include the knee joint. So bend your knee for me. I'm just doing this to show you guys. Her knee is right here, straighten it out. So what we wanna do is make sure that the IR goes beyond there, which remember the light is kind of deceiving. So the IR actually goes to about here, which is good because that's about 2 inches below the knee. So that is perfectly fine right there. And so there is no, really with the distal femur, central ray is just including that and then in the middle and your bucky aligned. And then the only thing we do is collimate side to side. And we have to make sure that we get a true AP of the knee, so we roll the lower extremity in about 5 degrees so that the knee is perfectly AP, just like when we do an AP knee. The only difference with that is we usually angle based on the thighs and buttocks. This is right. I'm just gonna put it lateral to the part, so I'm gonna stick it right there in the light field on the table. We've got it right in the middle of the leg. We're including the knee joint. We're set at 80 at 12.5. We'll shield her on this one. I'm just gonna have you stop breathing when I go to take that exposure and hold your leg just like that, okay?
Okay.
All right. Go ahead, stop breathing for me. Good. You can breathe, relax for 1 second. All right. Now what we'll do is, I'm gonna move this for a second. We're gonna do proximal femur. So I'm gonna bring her down. Now, just so you guys know, you can see that the IR ends about here. I know with her iliac crest here, there's no way I'm not gonna overlap. Does that make sense? Because we said we tend to collimate. So like the IR ends here, her iliac crest is here. So I'm gonna move this. And I'm gonna collimate to 12 and 10 by 12 lengthwise. And this one, we're gonna actually, I'm gonna rotate her foot in 15 to 20 degrees to place the femoral neck parallel to the IR. So her leg gets internally rotated. I'm gonna find iliac crest, and then I'm gonna find ACIS. Okay, so ACIS is right here. And on this one, we said that it's 1 to 2 inches medial to ACIS and 3 to 4 inches down. So there's ACIS. 3 fingers is 2 inches. So I'm gonna, I'm gonna come about an inch. And then 3 to 4 down. That's 2. That's probably right in between 3 to 4. So let's say I was gonna do that. Now the cheat that I'm gonna tell you, you can relax your leg for a second. Typically, if you bend their leg, straighten it, you end up right in the crease of the hip. Like literally, this is where her hip crease is. Bend. My hand is right my hand is cupped right in the crease. And that's typically right where you end up, which is what, if you think about it, when you bend the knee and you bend the hip like that, that's exactly where you are, is right in that femoral neck region. So you find ACIS. It's 1 to 2 inches medial. That's about probably 1.5 would be my guess. And then 3 to 4 inches down. So that's 2 inches. That would be 4 inches. So I'm probably about 3 inches down on that. I'm gonna go back and internally rotate 15 to 20 to get the femoral neck parallel to the IR. I'm lined up there. And on this one, since I don't really have light field on the table, I'm just gonna go ahead and put my marker, I probably have overlap there, so I probably put it low, just like that. As long as she doesn't have a prosthesis that would get in the way, I'll put it right there. I can't shield on this one, so I'm not going to put it on her. If she was really that young of a patient, I could probably go like this and attempt to shield one side. So we can do that just because she is young. I'm gonna have you hold just like that and then stop breathing when I tell you to. Okay. All right, hold still right there. Same technique, 80 at 12.5. Deep, good. You can relax your leg. All right. Now this one, now we've done AP distal, AP proximal. Now we're going to do a lateral of the proximal. So what I'm gonna do is have her bend her knee and let your leg come out towards me. Just about, right about there. I'm gonna move this for a second. All right, and I'm gonna find ACIS again. There. We're still gonna be 1 to 2 medial from that. So if I'm on it, I'm gonna bring it over a smidge, and then 3 to 4 down. So that's 2. That would be 4, so I'm gonna bring it up a little bit. Okay, so right here is ACIS. That would be 2 inches. That would be 4 inches, so I'm about 3 inches down. And with it here, I'm about 1 inch medial. Again, if I bend her, I'm right in the crease, which is typically just like a a good cheat for you to know. If I bent her and my central ray was way up here or way down here, then I'd know I was nowhere near it. But you want about a 45-degree angle on that. And this is the one that typically when we do that, we can turn the tube head to run with the length of the femur. So her femur's like that, and this is running lengthwise with it. Does that make sense?
Mm-hmm.
And then I would put marker, I'd probably stick it up there for this one. Just because I know I'm not gonna be in the way of that. I know it was lined up before, but it doesn't make sense to check it now because I've turned the tube head. All right, just like that. I could do the same thing and kind of lay it over here. You okay like that?
Mm-hmm.
All right, just like that. Just stop breathing for me. Beat, good. You can relax.
Not too much.
You can straighten it out. And now we're gonna do a lateral of the distal femur. Don't look like I was lined up. All right, we'll move that. I think I was a smidge off. Now we're gonna have you scoot away from me a little bit. Good, just like that. I'm gonna open this back up to 17 inches long. I'm gonna bring this, move you down on the table. And what you're gonna do is roll up towards me, but keep that leg behind you, good. We're gonna bend this knee. Good, roll your hips more towards me so that you're almost on your side, good. And straighten. What you wanna try and do with this, like if you see her femur is not aligned with the table, so I wanna bring your hips towards me, good. I want this femur relatively straight. Does that make sense? Like you don't want her hips too far back, and you don't want her knee, I don't want her knee too far forward. So you're trying to keep everything aligned. You kind of want, just like when you do a lateral knee, you want to make sure the patellar surface is perpendicular to the table, and you have to include the knee joint. Now the joint is right here where my finger is, so I'm going to come down some to make sure that I get beyond that. Make sure this is lined up. And I want her femur running. Bring your hips towards me just a smidge. There you go. And the biggest thing is keep that one out of the way. Good. All right, so lateral leg condyles should be superimposed, but they won't be right over the top because there's no angle. Patellar surface is perpendicular. Lateral on the leg. I'm gonna put this in the light field. Good, just like that. And I'm coming all the way up here. Now, ASIS is here, so I know that I have that in the light field, plus the IR is coming to about here, so there's no way I don't have overlap on that. Just like that, I'm gonna have you hold still one more time. Put this on me like that. All right, right like that. One more time, stop breathing for me. Beat, good, breathe and relax. So 4 views, 2 AP, AP proximal, AP distal, lateral distal, lateral proximal for a femur. All right, you can lay back. I'll go check those, and then I'll let you get dressed and you'll be all set.
Okay.